Connecticut, along with the nation, has had an unprecedented rise in overdoses from opioid use. The U.S. Surgeon General and the Centers for Disease Control and Prevention emphasize the importance of getting naloxone into as many people's hands as possible to help turn the tide of deaths. Joining us from the Connecticut Department of Public Health, Amy Mirizzi, along with Ramona Anderson, to tell us about this new initiative. And Amy, what are you seeing out there?
So sadly, in Connecticut, on average, 3 people die every day from an overdose, and that adds up to over 1,000 deaths a year across the state.
And how do we rank compared to the rest of the country?
Compared to the rest of the country, in 2017, Connecticut ranked 11th in overdose deaths across the country.
And that's why it is so important to raise awareness.
Exactly. So the Department of Public Health really wants to take a key role in looking at the number of overdoses in Connecticut, as well as to get information out to the public and build education and awareness around the opioid crisis.
And part of that education, Ramona, is a new app. Tell us about that.
Yes, the NORA app, the naloxone, now I'm going to get the thing messed up. I'm sorry about that. Naloxone Overdose Response app, which is actually
NORA.
Yes, NORA, which is actually a progressive website, which is the way a lot of the new businesses are going now, so that we can update information quickly when things are changing with this field. So anyone can sign on to www.norasaves.com, and they can access it on their desktop or on their phone. It gives instructions to easily save it to their home screen on their Apple or their Android device, and they can interact with many different screens to get information about obtaining naloxone, filling a prescription for it, doing training on which type of naloxone to administer to people. Also, if they wanted to get information about any kind of treatment services, other prevention or discarding of their medication. And so we can easily walk people through that if they need information.
Who's your target audience for this?
Everyone.
Yeah, so really we wanted to create a simple, easy-to-find resource that teaches people about the basics. What are opioids? How do I recognize an opioid overdose? Where do I, as Ramona said, where can I get naloxone and how do I give it? So we really encourage people who don't know anything about naloxone. So I don't know if we've explained for anyone who doesn't know.
I was just going to ask you that. For those who don't know what naloxone does, what does it do?
And some people refer to it as Narcan, which is a type of naloxone, but it's a life-saving medication that can reverse an opioid overdose. And
but it has to be done fairly within a time constraint, right?
Yes. So we encourage people to, if they have a loved one with an opioid use disorder, to have it available. It can, once given, it can restore normal breathing to a person experiencing an opioid overdose within minutes.
And this app, I understand, is also in Spanish?
Yes, actually we've expanded it now. We have a total of 4 languages: English, Spanish, Portuguese, and Polish. So anyone that can log in, there's a little language icon in the upper right-hand corner. They can click that, and then all of the screens will be translated into the appropriate language for them.
Are you seeing that people are using it?
Oh, yes, definitely. We've seen almost 30,000 views of the pages since last April.
Oh, that is wonderful. Yeah. And the website for it, for people who want to get there quickly?
www.norasaves.com. And we do have instruction if people want to contact us. There is information on the app if they want to do follow-up. And they also want to see maybe what they have in their medicine cabinet. We have quite a few people that say they don't even realize that they have opioids in their home. So they can get the list on the app to see if it's something that applies to them in their home, and if they have someone that they know, friend or family, if it would be beneficial to have this information.
It's very good. Ramona Anderson, Amy Mirizzi, thank you so much for joining us.
Thank you.
Thank you.